Okay, welcome to the April meeting of the Chautauqua County Human Services Committee. I'd like to call the meeting to order and like a motion to approve the minutes from 3:15. Do I have a motion?
I'll
Jamie?
second.
Okay. All in favor?
Aye.
Opposed? No. Motion carries. Do we have anyone here for the privilege of the floor? Anyone for privilege of the floor? Seeing no one, we'll go to the first proposed resolution, which is to confirm the appointment for the Chautauqua Opportunities Board of Directors. Would anyone like to speak to the individual here who is in front of us, Natalie Lukoviak?
Nope.
Okay, all in favor?
Aye.
Anyone opposed? Carries. Resolution number 2 is to confirm the appointment of the Chautauqua County Youth Board. Carolyn Thomas. Anyone to speak to this?
Nope.
All in favor?
Aye.
Aye.
Opposed? Resolution carries. Resolution number 3 is to consolidate the Home Energy Assistance Program, HEAP, Department A 6141, 2023 budget into the Social Services Administration A-6010 for the 2023 budget. Welcome. And for the record,
Carmelo Hernandez, Director of Mental Hygiene and Commissioner of Social Services.
And Kathleen Dennison, Chautauqua County Budget Director.
okay.
This is a resolution that we have considered for some time to essentially dissolve the separate department for Home Energy Assistance Program, HEAP. Currently, it's Department A 6141, and we would like to roll that into A 6010, which is Social Services Administration. The HEAP department, it has never really appropriately captured all of the expenses associated with the program. It does capture the revenue because that revenue is specifically identified, but the program has grown over the last few years, and so some of the expenditures involved in administering it, they have now been spread over several departments. And so we'd like to consolidate them into 6010, as I said. We considered doing this last year when we were creating the 2023 budget, but at that time, we thought that there was a requirement to have it separated for our AUD or our year-end financial statement to New York State. But we have since found out that we do not have to separate HEAP and identify it on its own. So we would like to consolidate those budgets. And then if we do this, then we would move any actual expenditures that have been incurred so far this year. We would move them into the 6010 department.
Okay. Any questions, comments? All in favor?
Aye.
Aye. Opposed? Resolution carries. Thank you very much.
Thank you.
So that brings us to our discussion. We'll actually have 2 discussions. The first discussion will be the use of opioid settlement funds. Dr. Falk and Carmelo.
Dr. Mike Falk, Chautauqua County Chief Medical Officer and Interim Public Health Director.
Steve Kilburn, Grant Projects Director at the Department of Mental Hygiene.
Carmelo Hernandez, Director of Mental Hygiene, Commissioner of Social Services.
So we've been asked to give a report on and initiate some discussions about plans for the use of opioid settlement funds. I wanted to sort of, at first, I don't think that we need a reminder of the problem with opioids and the crisis that we're facing, not only in Chautauqua County, but the nation. But as a brief summary, nationally, we've seen 100 to 150% increase in overdose deaths over the last several years, largely due to illicitly manufactured fentanyl. In Chautauqua County, through 2016 to 2019, we averaged about 36 deaths per year. In 2021, we had 59 confirmed deaths. 2022, 50 confirmed deaths with 4 pending medical examiner autopsies and confirming tox screens. We suspect those 4 are going to be added to that 50. We have currently several streams of grant funding with OD2A, COSUP, HRSA, Healing Communities. We know that we are nearing the end of some of that funding, either this year or next. Steve can speak to that here shortly. When we look at the opioid settlement funding, about 46 states were involved in a multi-billion-dollar settlement with multiple pharmaceutical companies. Eventually, not to get into too many of the details, but eventually this means that upwards of $50 billion will be awarded to participating states for those states to then funnel down through local municipalities and counties such as ours here. Currently, in 2022 and 2023, Chautauqua County has received $917,000, roughly. $840,000, as we know from last year's budget season, have been appropriated for the medication-assisted treatment at the Chautauqua County Jail. And there was also a $5,000 appropriation for a speaker, the details of which I'm not sure of at this point in time. So currently we have $76,000 available. We are expecting to receive another $1 million by year's end, and approximately $250,000 a year for who knows how many years, maybe upwards of 10 years, depending on the settlements and that. So I think before we initiate a discussion about where we're going, I think it's worthwhile to consider kind of where we've been and where we are now with our efforts in battling this problem. County services, i.e. mental hygiene and the health departments, collaborating together, combined with very passionate and dedicated community partners and healthcare centers, really kind of all working together to establish this foundation from which we will be building upon with this sort of revenue source. And as we move forward with planning around opioid settlement funds, we can, I think, envision the county as the hub of that wheel, strengthening already existing connections and collaborations with our community partners and healthcare entities, while also implementing new high impact, perhaps some out of the box type programming in order to make a difference and ultimately save lives. That is our primary outcome, to save lives. But again, we first must understand what efforts are underway so that we can continue to build onto that current foundation and add some additional framework as we move forward. So I'd like to allow Steve to provide some of those updates.
Yeah, thank you for an opportunity to kind of review what are really quite a wide variety of efforts underway currently in the county, and some you may be aware of, some maybe not. As Dr. Falk has said, we do have various streams of largely grant funding that is coming into the county to help support efforts going on. Personally, I oversee some funding coming from HRSA, as well as now NIDA, National Institute of Drug Abuse, funding coming through Columbia for a very large study that they're sponsoring, Columbia University, called the Healing Communities Study. But probably more for your purposes, it would be important to know that there is a body that has been meeting, 4 or more years, called the Chautauqua Substance Abuse Response Partnership. And this group consists of the principal addiction providers across the county. So there's a very robust collaborative approach that's been underway now for years in strategically responding to the opioid and the larger addiction challenges that our county faces. If you have seen, and I hope you have, combataddictionchq.com, then that's sort of the public-facing brand. And I say that because one of our goals is to raise awareness of what services do exist in the county and how to access them. I'll try to give a very kind of high-level overview of some of the initiatives that are underway and do so around a kind of 7-point strategic plan that we're operating with. This is a plan born out of the data, born out of the experience. It's, I would say, as a county, becoming more focused the longer we lean into this in this sort of dedicated fashion. So, as Dr. Falk has said, the first of our emphases is, of course, to reduce the numbers of overdose deaths. You might be surprised to know, maybe not, that fentanyl overdoses are the leading cause of death of Americans ages 18 to 45. Both COVID, accidents, suicide, and everything else. So, we find ourselves in the national context with this problem, but our overdoses are far too many. We're learning more about what contributes to those overdoses, and we're going to continue to learn more about them with a new initiative, an overdose fatality review team, so that we don't just have numbers or even just mere demographics, but we're going to try to learn the stories of those individuals who do die from overdose, to learn patterns and ways that we could have potentially introduced services that might have avoided some of these overdose deaths. We have succeeded and will continue to succeed and grow in, I trust, the distribution of Narcan in our county. Literally thousands of kits. We call kits. These are nasal spray for administration of these kits. Thousands are distributed across the county, and hundreds are used. As just a kind of a note that has recently caught my attention, All-Star is reporting that in over a third of the cases where they most recently respond to an overdose report, the patient has already been administered Narcan by a bystander. So we're seeing the evidence of the fact that this distribution of naloxone is reversing many overdoses. Clearly, we want to do more. So we'll lean into that more. Emphasis number 1, reduce the number of overdose deaths. Emphasis number 2 is to get more people into treatment. We know where some of the most vulnerable populations are. Overdose, addiction in general can and does happen across demographic areas, across geographic areas, but that doesn't change the reality that some of its most prominent expressions are found in identifiable locations in our county. The cities, Dunkirk and Jamestown, are not surprisingly the places of the most concentration of overdoses, but even within the cities, we're getting more and more data to be able to identify the places where we want to strategically reach out to reach folks who could benefit and would benefit if they were to engage in treatment. Most people with an addiction are not getting treatment. In fact, the vast majority of people with an addiction are not getting treatment across the country, and true here as well. And as long as that remains true, we're going to be facing an uphill an uphill battle. So our strategies are to focus on those places, those neighborhoods, if you will, where we know the greatest need exists, and to do so in the awareness that for many people, the nature of addiction is such that at any moment in time, most people, as I said, are not in treatment if they have, even with a substance use disorder. Most of them are not looking for treatment. So our strategy will be to obviously include information about where treatment is available, but also to build bridges and relationships in those communities where we feel that there's some pre-work that's going to have to be done if folks are going to be interested in the significant step of starting into treatment. Our county has really robust treatment opportunities for people. We really don't lack in treatment, but we have to connect it with the people in need, obviously. The third part of the strategy that is underway is around prevention. We, as the county receiving these grant dollars, do support efforts by our partners, such as, and particularly Prevention Works. They, in addition to being in the school systems, have their own staff in some of the pediatric clinics so that they can take referrals. It's often said with some merit that we're not going to arrest our way out of the overdose crisis. To a measure, we're not going to treat our way out of it either. We're going to get upstream if we're going to see the future look different than the present. So we really want to continue to emphasize and expand every prevention opportunity. We're making increasing numbers of contacts and partnerships with the schools in order to get in front of young people. In fact, that speaker that I think you alluded to, that some of the opioid settlement dollars were used for, was Chris Herron, who spoke to hundreds of high school kids. I think it was last fall. Just to round out where our strategy stands, families are, in many instances, sort of the overlooked victims, if you will, of the overdose crisis and the addiction in general. And they are, in many ways, the most influential folks in people's lives, in all of our lives, for that matter. And when they are offered evidence-based supports, they can not only receive the support and the services that they need, because they're placed in very difficult situations. And, with the numbers of people, we probably have 15,000 or maybe more county residents with a substance use disorder. So you do the math, and most people know somebody, I say 1 degree of separation away from somebody with an addiction, or somebody who knows somebody with an addiction. And so I don't need to really, I don't think, make a case how difficult that is for family members. We want to give them the support they need and the kind of support that can actually help them help their loved one move towards treatment. And that's been a proven and evidence-based interventions that we're going to bring in some training we have scheduled to come in this summer to do that very thing. I think I'm up to number 5. We're not going to make any progress with all of these initiatives if we don't have a strong workforce. Many times we have good initiatives. We may have the funding for those good initiatives, and we really struggle to recruit trained staff. And so again, we have some things underway, and we look forward to expanding them. We're partnering with JCC's Addiction Counseling Program and the SUNY Fredonia Social Work Program, have had 5 semesters now, I think. So 30 to 40 of the most sort of promising students coming out of those programs have been enrolled in what we've called a leadership development program. They've gotten to know some of our agencies, all of which is aimed at keeping them in Chautauqua County when they graduate. This is the next sort of generation of the workforce. And we've seen some of them already employed locally. Finally, just to round up quickly, data. We're getting a lot better at data, but kind of historically, data around behavioral health services has been, just broadly, not just here, but has been kind of weak. But we're learning more and more about what works. We're learning more about who's at highest risk, where they live, and how we can hopefully reach them the best. But we really want to take and are expanding our ability to take a data-driven approach. And then finally, and then I'll stop, the 7th part of our strategic plan, both where we are today and where we look to go forward, is the reality that any number of social determinants, as they're called, are contributors to addiction and its perpetuation. And in our county, like others, housing is perhaps the most significant thing. As just one example, the sheriff would know well, and we've talked about this in various forums, folks coming out of our county jail who may have received excellent services and have received excellent services while in the jail, started on perhaps medication-assisted treatment, etc., well intended to continue their recovery as they transition into the community. If they don't have some form of stable, sober, supportive housing at that transition, candidly, much of the work up until that point is going to be kind of undone, and undone quickly. That's just one example. There's a lot of folks for whom their housing situation is going to be the make it or break it. All the other 6 are difficult. That one is very difficult, obviously, but we recognize that this is going to be key to moving the needle regarding addiction and addiction services. So those are kind of 7 strategic priorities that we are working on, have been working on as a community. I think the county government is doing a very good job, as Dr. Falk said, is kind of leading, bringing together, sort of serving as the hub, but partnering with every one of our county agencies to do this in a collaborated, a coordinated sort of way. Okay.
Steve, can I ask you a question?
Of course.
So, first of all, thank you. That was
Yeah.
extremely informative. And you mentioned, with regard to prevention,
Yes.
and throughout my children's school, there was a DARE program. Has there been any statistics on the effectiveness of that program, or a resurgence of it? Or, I mean, it gave them a law enforcement role model. It
Yeah.
was a great program.
Yeah. Nationally, I can say, Jamie, that DARE, dare I say, didn't pan out in terms of outcomes entirely the way it was hoped. That isn't to say it was an abysmal failure. That isn't to say that many kids didn't benefit from it. But it's kind of the model that's been replaced by some others. And one of our Prevention Works colleagues would be better able to address this. But I think, as I understand it now, when they're in the school systems, and they're in some form in every school system, although not in every grade in every school system, so that could be expanded. But what they tend to, especially in the younger grades, really emphasize now is like life skill type things: self-esteem, peer pressure, handling emotions, healthy friendships, and these sort of things which they see, and I think the evidence would bear out, strengthen a young person to resist both the internal and the external pressures that they're going to face as they get older to use substances. Again, I don't want to say that DARE was a failure, but it's kind of the model that is considered like maybe a generation ago. Yeah. But there are other things that have taken its place.
Good.
And the sheriff could speak to this. I know his heart is to be in the schools, and I think they've got officers that come into the schools.
Seniors teaching DARE, by the way.
Okay, so I'm on the record as having, I'm not saying it didn't work. I'm just saying that's the evidence that's been reported.
Thank you. You're
Okay.
good.
So in terms of everything both Dr. Falk and Steve said, we know that there's an issue here, and I believe in my heart the way to attack it is head on. The only way I know how to do things is hard charge it and go forward in a multifaceted realm. Really, the workforce is an issue, which is why I think partnering with our community partners is going to help, because the more of us that we come at it together, the more resources we'll have together. To ask one agency or one entity to take this on would be foolish, and that's not what we want to do. And we want to really, spearhead and lead the way with our community as a whole and with the partners. Another piece is, and this is going to be sound cliche, but these neighborhoods, we need to get into these neighborhoods. We need to get into these neighborhoods and win the hearts and minds of the individuals in these neighborhoods, where this way they can trust us and trust that the resource that we're providing and the service that we say you can receive here, hey, I can go there and receive this service, or I'm ready. So it's multi-layered. So there's 6, I got them on here, pillars that we need to hit for Oasis. Treatment when it comes to the funding. So it's treatment, prevention, public awareness, harm reduction, recovery, and transportation. And Steve mentioned this, some of the things that are on the way already. So we do have grant funding to attack some of these, but I really believe together as a whole with our community partners, developing a task force, really ironing out what resources do you have, what funding do we already have going here, and then how can we use this and be creative and innovative. I think short term, which is not really short term, is the individuals who are have substance use disorders right now and reaching out to them and building that connection and building that bridge. I think long term, if we really truly want to get ahead of this, is with the youth. I really believe that we get the youth and we grab them and we start educating them. We start giving them opportunities to understand what it is and also resources for them. One of the big ones for me that I would love to see happen, and I really believe we can get it going here with our community partners, is in terms of prevention, a youth clubhouse model that I believe, I don't remember which agency it is, but they were on, it was the resource center. They're on their way of making it happen for themselves. It was just resources and or workforce. Now imagine if we could collaborate together, and they obviously already have the space for it, and we can build this where now the youth have a place to go and a place where they don't have to fall into that peer pressure of picking up the bottle or whatever it is that leads them down this path, and the education piece that comes with it, and having that collaboration and really saying it's okay to come here. So I really do believe that together, as you can see, public health, Steve, even though he's with mental hygiene, but his grants and his partnerships that he's built, and then with us and what you heard earlier with the sheriff and what they've been able to do inside of the jail, that's also collaboration. I think that's the way we spearhead this. That's the way we lead it, along with our community partners, and bring them to the table, which they already do come to the meetings. And it's now saying, hey, we got this data now. Now let's take some actions. Let's go take some risks. Let's go. The numbers are there. We know what's happening. What do we got to lose by going into these communities? And I'm not only willing to send the team in there, I want to be there myself. I guarantee it. I will be there myself in these communities, looking at these people in the eyes, providing that hope and winning their hearts and minds. That's how we get ahead of this.
So it sounds like you got a plan, at least a formulation of a plan.
Yeah.
And using these opioid settlement funds specifically to implement these things.
Yeah, I mean, they
Some
really
are all-
pick up where some of the other funding is, as Dr. Falk said, going to leave off. You know, some of the funding, as grants do, is within the year those streams are going to end. So yeah, I hope that we've been able to, paint a picture of the fact that there's been a lot of very focused efforts that have already been going on. And as Carmelo says, we're going to, and are taking it kind of to the next level, if you will.
Carmelo, you touched on something last month, some of the bigger grants you're chasing. And one of those was particularly focused in the schools, correct?
Mm-hmm.
Does that fall into this?
It does, actually. One of the things that it was interesting because we're waiting to hear back on the grants that we applied for. I do believe we're going to land one of them, and one of those grants will be having a part of this initiative in it. So we won't have to use the opioid funds for that. We can use it for something else. So we're not only trying to maximize our workforce, because we know that's something that's there, maximize our partnerships, which is important to do because one person is not going to be able to do it all, but also maximize our resources in terms of finances to really be efficient with it and to really not only be efficient, but be effective. And that's the goal. Steve says it all the time. We have services. We have tons of services. And I say it all the time to Steve. I say we're lucky if somebody can make it from home to their appointment, and they're at that level and at that stage. I'm concerned about the person that can't make it or is not even there thinking clearly to be able to make it. And how do we get that person? How do we get that family? How do we attack that? So really, really becoming effective with our resources and finances. I think we can really maximize and really got an opportunity to really do some real positive things.
How do you get into these neighborhoods? Just boots on the ground?
Oh, it's going to have to be boots on the ground, which I love as an infantryman. So for me, I'm okay with it. But we do have the data. So we do have the OD map data. We do have Dr. Falk's van that's coming in from, where is that? Columbus?
Right now, so our mobile health unit. It's actually, a mobile health clinic on wheels. we plan to utilize this in a variety of ways, but specific to this conversation, we're going to park that thing right in these neighborhoods in a parking lot. Sell hot dogs, bring backpacks. We've talked about these things, and provide access to care, maybe even start care right from there, whether it be in person or telehealth, and just create a lot of action around that.
When is that?
The van,
Yeah.
it's getting graphics now, so we'll roll that out. Pictures of that soon, hopefully, to everybody. But we should have that by, I would think, we're looking at another month or so.
Memorial Day.
Yeah, anybody's willing to take a ride to Columbus with me to pick it up, I'm more
I'll go.
than welcome.
So have you been in contact or collaboration with other counties to see how they're going to be using the funding?
I have. No, yes, I have. They got some pretty cool ideas. Some counties a lot smaller than ours, some a lot bigger. So they're getting creative with it. We have some that are actually doing a prom prevention, right? Because when people graduate, what they want to do, they want to go ahead, you have some drinks with your friends, and you get involved in some stuff. So what they're doing instead, they're throwing pizza party. They got an ice cream truck coming, and they're movies. They're providing education for transportation. I know a county that's actually purchasing bus passes and collaborating with the local cab companies in the area and having vouchers so that people can make it to and from their appointments. Another county is actually doing co-pays for whoever can't afford their copay and says, I'm not going to go see my provider because I can't afford the copay, doing stipends. So DCSs are getting creative across the board. So it's something that it's exciting to see. And the one piece that for me, my takeaway from hearing from just investigating and really picking their brain is really bringing the whole collaboration with the entire county. I think that's where we stand out. I think that gives us a real fighting chance at really not saying not only was this cool and did this leave an impact and a mark on that family or on that community, but man, now how do we make it sustainable once the opioid funds is done? That's the goal.
Thank you. I appreciate your enthusiasm and information.
Sure.
Kind of think of where I appreciate the hearing this information. So when we have to make a decision about where the money is spent or spending, we can be able to save it for. We know there's going to be a need soon enough.
Sure.
If that's the place. So we had spent some money on this MAP program, and a pretty good chunk of it. Is there? We've tracked on that program a little now. It was kind of a guess of how much that might cost the county in aspect of, where are we spent on that? Is there a chance that some of those funds could be put back into this or
Continue to fund previous or
yeah.
subsequent years. Yeah, I mean, so far for the first quarter, we're looking at least up until this date, mid-April, just in medications alone, about $96,000. We had budgeted for 6 positions, several of them nursing positions, counselor position, supervisor position. We've only been able to fill one of those. So we are right now, under budget. So if things continue this way throughout the year, we will have money to be able to put back into the fund or use for the MAP program in subsequent years.
Mm-hmm.
We're hopeful that, we will hear from the state about funding, or which would even be better, the ability to bill for those services to insurance companies, or Medicaid. Right now, we for those incarcerated individuals, we cannot have access to billing insurance companies for medical care, including medication-assisted treatment. So certainly something everybody's lobbying for, and there has been a little bit of movement on that. So that would be a big deal if we're able to bill for services.
Last year I visited the jail, and I met with Colney in there and about the housing. And it's been a year, and you had some things in the works. It is still an issue. Has some of those things you were researching before? Is it any better? Are we trying to work down the path that we can come to providing that a little, more stable in our community after these individuals are Any update on that? Or?
We actually just had a meeting, a housing meeting
Mhm.
with all our partners and providers as well, and seeing what the need is, where the gaps are. And one of the things that came out of it that's happened, the county is actually leading the way, is in actually conducting an assessment of the county in terms of the housing need. So actually conducting a needs assessment where now we can use that data and really, once again, effectively deploy what we need to deploy and where we need it. I do know that we just DSS just granted $100,000 for the women's shelter, so they could finish rebuilding the insides of that of what they needed to rebuild. So that's already on the way. So that's good news. I received news this morning, which it would help with this as well. UPMC, Office of Mental Health, and Recovery Options Made Easy have finally agreed on a lease term. So congratulations on that one. That finally happened as of this morning. So that's going to help out a lot as well. So with all these moving pieces, I think it'll help. Most definitely need a little bit more. I think the other pieces that came up in the meeting that we had was investors, getting investors to come in. And when an investor comes in, they're going to want to know what's their return on investment, what is it going to look like. So that's where the needs assessment is going to be able to play out, and we can be able to see who we can collaborate with.
Mm-hmm.
Yeah, I mean, housing isn't entirely my lane, but just to echo those same thoughts, we all know that the housing stock in many instances is just not real healthy. So it's such a heavy lift to move the needle around housing. And there is a lot of our partners who are working hard and making progress in doing that. But this is the biggest lift, but in many ways the most important. And, I could just to add to this, which again, I think I'm only saying what you would already know, addiction is a sort of immeasurable, incalculable human cost, of course, especially at the tragedies of an overdose fatality. But there are all kinds of other costs associated with it. And I'm familiar with one study that I can't remember off the top of my head where the researchers came from, but they tried to make some sort of educated estimate about the cost at the county level to the opioid epidemic alone, which doesn't account for what remains really the two more deadly addictions, nicotine and alcohol. But the opioid epidemic alone, based on their calculations, would probably cost our county something like $20 million a year across sectors: health, criminal justice, education, et cetera. So, as we lean into these things and perhaps have to make tough decisions about investments, et cetera, we have to keep in mind that every step we make in reducing addiction actually saves the county money in the long run.
Okay.
Just want to, if I may, I know the training still comes with the Narcan, the free training at that.
It does.
Just to mention,
Narcan is very available, and this is my place to make another plug for Combat Addiction, chq.com, because that site, among its other information, is where a person can get free Narcan and the training that would go with it.
thank you.
Anything else?
Thank you.
Mr. Chairman,
Yeah,
if I
great
might,
Oh, yes.
I certainly appreciate this discussion. And we're nearing the budget season, which is always an interesting time in the lives of legislators, as well as other departments in the county. But it's important, I think, that we understand how our opioid settlement funds are being used and how they could be used for the greatest benefit to the community. And that's really the nature of this discussion today. But I would expand that a little bit to say, once we're in the process of understanding and reviewing the county executive's tentative budget, we would like to have a broader understanding of how the county resources in total are being applied to this opioid crisis that we're all experiencing, the community is experiencing, and what opportunities there may be for greater support from the county. That's a difficult thing for me to say as a county legislator because it kind of sounds like more money, But certainly, this is so important to our community that we should have a broad discussion about this beyond just the opioid settlement funds.
Mhm.
Okay? Thank you.
Very good.
Thank you very much for all that you
Thank
do.
Thanks.
Definitely. Thank you.
Dr. Falk, I think you need to stay. 'Cause we have one more discussion, Sheriff and Dr. Falk. Oh, and Patrick. Please let us know who you are.
James Quattrone, Chautauqua County Sheriff.
Yeah.
Dr. Mike Falk, Chautauqua County Chief Medical Officer and Interim Public Health Director.
Patrick Slagle, County Attorney.
So this evening's discussion is regarding the services that are offered in the Chautauqua County Jail for medical and mental health services. Kind of tag team in this, Dr. Folks is going to talk about all the work that the medical team and mental health services do. Patrick will share a little bit about why we're here today, and then I'll just pretty much repeat what they've said.
Sure. So you may have seen in the paper recently a couple articles about some jail deaths that occurred back in 2021. A final report that was issued in 2022, a report that is disputed by the county, and the Attorney General actually did an investigation and found no wrongdoing. Nevertheless, the report from the commission asked that the legislature do an inquiry into the jail medical. I think it's important to understand that while the legislative body doesn't directly appoint the medical providers in the jail, it does do the budgetary work of passing the budget for the Human Services of Public Health Department to provide for that jail medical. Tonight, there's not really going to be discussion on the facts specifics of that case. That will come at a future time. But tonight, I thought it important for the public and really for this body to understand what jail medical involves. I think it's, when I first began to learn about it, it's vastly different than what I thought it would be. And the work that these two individuals and their staff do is nothing short of amazing. And so I'll turn it over to them to give you a description of what jail medical involves.
So some of you have the pleasure of hearing this twice, so thank you for your patience. I appreciate that. As a reminder to, most of you already know this, that the health department, a few years back, took over the oversight, the management, and the staffing of the jail medical services. My role, as most of you know, has evolved over the last couple of years, in particular over the last couple of months. And I specifically, as one of my hats that I wear within the county, is I took over in October of this past year the medical provider role, along with Dr. Brian Walters, after our PA resigned at the beginning of October. So I've had several months to really be embedded with the medical staff there and getting a firm understanding of what we do, what they do, and the extent of which they're providing that care. To summarize and review those medical services, it really includes comprehensive access to routine medical management, acute and subacute illnesses and injuries, preventative health care, chronic disease management, coordination of ongoing and outside medical consults, and follow-up with specialist care. To start, all incarcerated individuals are screened at booking for acute or active medical and or mental health conditions. This includes drug or alcohol intoxication or withdrawal symptoms. Medical personnel are either on site or on call 24 hours a day, 7 days a week, if there are questions or concerns that arise. So specifically during the weekdays, we have 3 to 4 nursing staff on in-house on duty. In the afternoon, evening shift, we have 1 RN, and then either myself or Dr. Walters are on call really 24 hours a day and overnight if correction staff have an issue on the overnight hours. All incarcerated individuals receive comprehensive medical care and mental health assessments within 14 days. Obviously, many of incarcerated individuals are only there for a day or two, but those that are there within 14 days, we do everything that we can to provide that nursing, medical, or mental health assessment within those 14 days. Many times, if there are urgent matters, individuals will be assessed by medical or mental health staff much sooner than that 14 days. Based on that initial screening, and sometimes that happens within days or even hours of arrival and booking. The vast majority of individuals are incarcerated for days to weeks, generally focusing on more acute medical and mental health problems. We do have individuals incarcerated for much longer than that. We currently have 42 federal inmates. Obviously, those individuals who are there longer require regular preventative screenings. An example of that would be colonoscopies and chronic disease management for things like high blood pressure, high cholesterol, asthma, chronic obstructive pulmonary disease, and diabetes. And in addition to regular dental care by a dentist. So 20 to 30 incarcerated individuals are cared for every day in the medical unit. And this includes things like sick call, medication-assisted treatment, health screenings, blood work, x-rays, dental work, et cetera, et cetera. And that's for a jail census of plus or minus 170 individuals. This really is a testament to how chronically ill this vulnerable subset of the population is. Keeping in mind that perhaps upwards of 40 to 60% of these individuals struggle with drug or alcohol addictions. Most of the time, their individual health prior to incarceration takes a back seat, and compared to the average population, they bring proportionately more acute complications and deteriorated chronic conditions due to lack of medical and mental health care, basic hygiene, and complications from drug use, some of which include skin wounds, malnourishment, complicated infections, and overall poor health. I'm going to share some statistics with you just from the first quarter of this calendar year, January through March. Some of you have already heard this number, so I won't make you guess again because we know that what the number is already. But just out of the scheduled nursing visits, acute visits, doctor visits, withdrawal visits, health assessments, and medication-assisted treatment visits, we have had from January through the end of March 1,935 visits in the medical clinic. With that said, we average around 5 emergency 911 calls and transports to the hospitals every month. Those can include things like abnormal vital signs, somebody with chest pain, somebody who's injured, somebody who's having difficulty breathing, or somebody who's having abdominal pain. Over the last 3 months, have had 64 in-house dental visits, 51 hepatitis C screenings, 65 HIV screenings, 54 gonorrhea and chlamydia tests performed, 677 visits by mental health staff. This includes counseling, therapy, physician, and support staff, focusing on reentry, crisis visits, alcohol use, case management, substance use disorders, medication-assisted treatment, 14-day assessments, and mental health evaluations. Within that time, 31 group visits focusing on relapse prevention, anger management, and anxiety disorder. Going back about 2 years, the leaders at the time, and I have to give credit where credit is due, Sheriff Quattrone, previous public health director, Christine Schuyler, got together and asked the question, how do we standardize and elevate the care that's being provided at the county jail? These leaders were committed, and we continue with this commitment now to seeking and implementing a nationally accepted standard of care in health services within the correctional settings. And what I'm talking about here is the accreditation process through the National Commission on Correctional Healthcare, the NCCHC. It should be noted that across New York State, there are only a couple known correctional facilities that have this national accreditation. We had the jail had its first survey summer of 2022 with a second survey done February of 2023 with a very positive exit interview and our expectation of full accreditation later this year. This is truly a testament to the dedication, passion, and experience that both our medical and corrections leadership bring to this Chautauqua County facility. And I have to acknowledge our community health nursing director, Kathy Burgess, who really spearheaded a lot of these efforts. And also Allison Espin, our correctional nursing supervisor. They worked tirelessly over that period of time, countless number of hours developing policies and protocols to satisfy the accreditation. We're talking 54 new policies and procedures within the healthcare facility in the jail. This also includes a quality assurance and infection control team that meets quarterly. And really what this allows us to do is it allows us to be held to a very high standard that, again, very few have achieved across the United States, and in that, for that matter, across the United States. Some of the other developments going back a couple of years, the health department and the jail medical has been able to implement and utilize an electronic medical record called MedEnt, which enhances coordination, communication, and medical documentation. No more paper charts. Medical team and mental health team are now using the same platform, which was not the case up until about 6 months ago or so. This really improves collaboration and communication between the mental health and medical teams, something that we've been working very hard on. Medical and mental health meet at least weekly together, specifically for our medication-assisted treatment program. That's 11 o'clock every Tuesday. But also the team in large part meets at least monthly during our correctional health team meetings and quarterly during correctional health administrative meetings. The last two of these meetings, the warden and sheriff also attend. And again, this is a true team effort. Specific to our medication-assisted treatment program, we've had 606 visits over the last 3 months from January 1st to end of March. Obviously, these are multiple visits by multiple people. 80 individuals have been started on medication-assisted treatment. 25 are currently active. We do have some challenges in recruitment. As all of you know, we have for the 2023 budget, we have approved 6 new positions specifically for the medication-assisted treatment program. We've been able to hire 1 LPN. Very challenging recruitment. We talked about workforce on our last meeting. In closing, I hope that this summary gives you and the public a better understanding of what happens within the walls of the jail specific to medical care. With 20 years of almost 20 years of emergency medicine practice, I certainly now acknowledge that we can't heal and save everyone. But we sure try awfully hard to do that with comprehensive and compassionate care. That team across the street, those nurses who are doing this and in that facility every day, really need to be acknowledged, and they should know that they are making a huge difference in saving dozens of lives every year. Thank you.
Thank you, Doctor. I just want to echo a couple things there that, first of all, the staff, the medical, the mental health, correctional staff to get this national accreditation had to work tirelessly. They spent many hours above and beyond what is required for their normal duties, many hours at night working to get these policies done. So appreciative of Kathy Burgess, Allison Espin, Dr. Folk. I feel bad when I suggest ideas and then say, here it is, because they have a lot of work to have to follow through to get this. But we're proud to say that we're quite certain we will get the accreditation in May or June, get notified of that, and be one of less than a handful of jails in New York State to get this. And what's important to note is New York State Commission of Corrections has what they call minimum standards, standards that we have to abide by, but they're minimum. This NCCHC accreditation goes far above those minimum standards to provide the care that's necessary in the jail to people who are really coming in to the jail sicker than they ever have, partly because of COVID, partly because of bail reform, and many of these people don't seek treatment, when they're not in jail. And while I'm very happy with my primary care physician, if I needed a doctor or medical help and was permitted to go to the staff in the jail, I'd be happy to do that, because again, the care that they provide goes far and above what some people would expect. Thinking about our jail, it's the largest congregate care facility in the county. If you start looking at the hospitals and nursing homes and the populations that are there, there's more people in our jail. The only thing the doctor said wrong was we actually have 182 people in our jail today instead of 170. We've been averaging that number for a little while now, but they get proper care in there. So. And lastly, while I didn't say this the first time, but because I didn't hear the talk from Steve and Carmelo, and it is important, and I really think this would help us in our jail as we start to look at a good plan of prevention and education and treatment. I know normally from the sheriff's office we're talking enforcement, but we really need those other three categories if we are going to start to put a damper in the drug problem in Chautauqua County and really across the country. We have to have a well-balanced approach.
Okay. Any questions?
Yeah. What's a procedure when there's refusal of treatment, like for mental health or all of the above? What's your procedure on that?
Yeah, that was a really big deal for the accreditation, actually. Typically, we would have somebody, if they refuse the medication, there's a signature, refusal signature. What we've been doing lately is when somebody refuses, it's not like, it's not okay, no problem, we'll just have you sign here. It is a medical clinician, typically the nurses, because they're there every day, will provide education as to, why are you refusing a medication or an intervention or a counseling session or medication assisted treatment or whatever it is? Do you understand that that may cause X? Do you know that there may be other options for you? So that education process has been implemented recently and really has been something that we've revamped almost completely over the last several months, and mostly due to the accreditation process and them pointing that out. But yeah, I mean, and that's documented. Those refusals are documented very clearly.
Thank you.
Yeah, sure.
Appreciate it.
Anything else? Okay. Thank you very much. Okay. Is there any other business to be
Appreciate it.
motion
Thanks, Sheriff.
to adjourn?
I'll make a motion to adjourn.
Second.
Second, all in favor?
Aye.
Aye.
Opposed? Absolutely not. We adjourn.